tune in. Just to recap, this is Nicci, our biokineticist. I'm Ashleigh, I'm the clinical director of Ultra Sports Clinic, and we're just doing a live session here to let you know what biokinetics is and how it can help you in your sporting and everyday life. So Nicci quickly recapped on, that her degree takes 6 years. She's a rehab specialist. We had a really interesting question about whether you should, if you have shoulder pain, whether you should see a bio or a physio. Would you like to recap that?
Yes, yeah. I can. Like I said, I often get that question, should I see a physio, should I see a biokineticist? And my answer was you should see both, but it all depends on what phase you're in. So I will generally only see a person, say you've had an operation 6 weeks post-op, and then I'll start my rehab. So they get all the basic muscle groups firing through the physiotherapist, and then from there I will then take the person onto a long-term plan, and that's the aim. And if they are, say they play some form of sports, if they are a cricketer or any overhead sport, for example, I will then incorporate that movement into a functional sporting exercise, if that makes sense.
So basically what we said was, if it's an acute injury or something that needs, a physio's attention, that is where they would go.
Yes.
And then basically if it was something like, let's say you were playing tennis and you suddenly felt like you were losing power, or you didn't have a certain pain, but you just felt like you weren't as stable, that would be the perfect time to come and see someone like a biokineticist.
Exactly.
So generally, physios do rehab, but they don't do it to the same degree that a biokineticist
would do basically.
rehab.
Yeah.
Great. All right, so we are moving forward with our questioning, and we decided that we'd talk about knees and anterior knee pain. And Nicci was talking about the fact that she looks at the muscle recruitment and the alignment of the knee while doing exercises. So someone like ACL, anterior cruciate ligament rehab, is this the perfect type of patient for you?
Yes, I absolutely love ACL patients. So yes, definitely. From my perspective, they've obviously seen the physio, they've had their 6 weeks. With ACL, you've got to start to build the musculature because your body's been through a bit of a pounding. You've had an operation, they've gone into the bone. So not only are you you weaken certain muscle groups, but you're going to be stiff, and it's all about getting you moving again. So for that person, it's getting you strong in the correct muscle groups and then progressing you eventually into plyometrics and jumping type movements. And it's also reassuring the patient that they're not going to hurt themselves. But people are very scared after operations, and that's what I'm here for. I'm here to reassure them with my knowledge that they actually are going to be okay and they're going to be guided in the right direction.
And take them up a level each time so they can then return to sport.
Yes, exactly.
Great. So we have a question here. What is the difference between biokinetics and a personal trainer?
Okay. Well, for starters, the length of studying is firstly my answer. I study for 5 to 6 years. A personal training course can be, I think, maximum a year. So I have my knowledge base is a lot bigger, wider. My anatomical knowledge, my physiological knowledge, how muscles recruit, why they recruit, when they recruit, is a lot bigger than a personal trainer. Personal trainers are also more for your general population. So if you want to lose weight,
keep fit,
tone, all of that.
So, if you take a strength and conditioning coach, that's slightly different because, they do a lot more training, and they're a lot more specifically rehab based. What you're doing is taking someone from injury or specific issues, and then training them around that and improving their performance.
In a safe manner,
Right. So you're looking at one joint rather than the whole body. And you're not doing the same type of thing.
No.
You're doing a completely different thing.
Completely,
So really a personal trainer and a biokineticist are not the same thing. A biokineticist is a rehab specialist that if you had issues with the shoulder, would focus on your shoulder and would do things like that. Am I correct?
100%.
And a personal trainer or a strength and conditioning coach looks at something global, and then so you would refer to a strength and conditioning coach or a personal trainer after you'd finished.
Yes.
For them to maintain and keep fit and things
exactly, that would be my next step.
Right.
Yeah.
So you'd go from physio to bio to personal training or strength and conditioning. So really everybody has their part to play.
It's all slot into the puzzle basically.
Good.
Yeah.
Okay, how can biokinetics help with my running?
Okay, right, so that's it's going back to some of the questions that we've already gone to. With running, it depends on what your distances are, but I'm just going to assume that this is a long distance runner or a marathon runner. What often happens with runners is they work only on the endurance and just their running style and getting their distance and getting the cardiovascular in. But the joints are going to take a pounding. You are landing on a hard surface, you're going to hurt the joints, they're going to eventually wear and tear. So from my perspective, I will then once again start to stabilize the joints and strengthen into the joints. Also have a look at the biomechanics around it, because quite often people are running and their stance and stride is incorrect. So I can often prevent injuries as well. That's where I come in. I'm going to prevent you from hurting yourself by strengthening into the correct position.
So how do you go about assessing someone's running style, and how do you go about changing that?
Okay, so I'll quite often just look at a person in the way they walk. So I'll watch them from behind, look at where their hips are moving. So basically a gait analysis. I'll then do a few functional tests, which will show me how the knee is tracking. So for example, I'll get a person to do a simple lunge. And I can, just by simply looking at the way they lunge, I can see what their hips are doing. I can see whether the hips are hiking. I can look at how the knee is tracking. Also the posture plays a huge part in running. Your arms play a very big role, your torso, your core. So just by actually just looking at where a person stands, I can get a huge amount of info, which will then replicate into their running style.
And then once you get to a certain point, you then go for a run with someone, watch them from behind, watch them from front.
Yes.
You know, and take them out into sort of the environment and do that sort of stuff.
Definitely, yeah. I've done it with a few patients, and I will also give them a sort of, if they say, for example, say they're trying to get back into running, we're going a bit off topic now, but say someone's trying to get back into running, I will give them a walk-run program, which will gradually get the person back into running in a safe manner.
Good.
Yeah.
All right, we've got another question here. What would you say is the difference between foot pain and knee pain in a runner?
In a runner.
So what would you be looking for? So what would lead you to say this is why you're getting foot pain or this is why you're getting knee pain?
Okay, so that would bring me to ankle stability. Okay, so foot pain in a runner, for example, it would probably be to do with their biomechanics and the structure of their foot. So people with high arches in their foot often get foot pain, which will come down to the shoes that they're wearing and the way that they're landing and the way that their ankle is landing. So if you have very weak ankles, you won't, your ligaments will be compensating for an unstable ankle joint, and your muscles won't be recruiting correctly. So in that case, I would look at how it's stabilizing. But to be honest, that's also connected to the knee. So I would also look at the way that the knee is tracking, because in that case, you can't just isolate. Because if a person is rolling out of their ankle, for example, the chances are their knees are knocking in as well. So it's the whole connected chain at the same time.
Right.
Does that mean?
Yeah, absolutely. So, you know, for those of you who are not runners who've joined us, you have to heel strike, roll, and then come off on your toe. You have to de-accelerate the foot from heel strike to midfoot, and then you have to accelerate the foot from midfoot to toe off.
Yes,
exactly. So you have to have a biomechanical chain to allow you to do that.
Yes.
If you are not tracking properly through your knee or your ankle, you will compensate somewhere and you will start to get some.
You will
sort of
eventually get a pain somewhere. It happens all the time.
The other thing that you would look at is probably shoes.
Yes, and I do look at that. I just look at, a person will come in, I'll just look at the back of their shoe and I'll look at where the tread pattern is, and I can get a lot of information from that as well, just from seeing the heel strike to the toe off, and I can get a lot of information.
You know, as a physio, I see a lot of patients come in with foot and ankle and knee pain, and they are wearing shoes that they should not be wearing.
Yeah.
So really, the first tip here is go and get properly assessed, get a good shoe for you, and if you're unsure, come to someone like us who can give you advice and then send you to the right sort of people to get a shoe fitted. It's the most important thing.
Definitely, it's the foundation, actually.
Good. Right, we have another question here. Can you help me with my ITB syndrome?
Okay, yes I can. All right. It all depends what's causing the ITB syndrome for starters. So I would have to give a bit more information. But often ITB is connected to knee pain. So once again, it roots back to bad biomechanics in the knee joint. You're probably not tracking correctly. So if you have ITB pain, I would firstly give you self-release techniques, and I would maybe refer you onto a physio just for some release. That's where we work nicely together. And then I would try and offload that ITB. So by offloading, I'll give you the correct exercises to get the correct muscle groups working. Because an ITB is basically, for those of you who don't know, it's a band running from the knee joint to the hip joint. And if biomechanics are not working properly, it's going to tighten up. And it's not even a muscle, it's a fascial band. So it's quite a hard thing to work with. So that's what I would look at.
Yeah, I find a lot of my runners who run a lot downhill get a lot of ITB friction syndrome, or ITB pain, or knee pain from that runner's knee. And really, as Nicci said, it's a flat connective tissue from the side of the hip to the side of the knee. All runners and active people will know that when it gets tight, it gets really painful and quite sore. Something you taught me was lots of glute strength and lots of core strengthening can really stabilize, because being a runner, you run on one leg at a time. So you have to have good core and spinal segmental control to be able to stabilize your pelvis as you're moving forwards. And if you're not doing that, then you can overwork the ITB.
And you compensate, and you just become dominant in the area.
Someone wants to know how many times or how often should you have a biokinetics session?
Okay, so I generally recommend to my patient, it depends on how consistent you're going to be with your exercises at home. So it really is patient dependent. I have some patients that say to me, look, I know I'm not going to do my exercises. So I'm like, right, in that case, I need to see you at least twice a week, because then you're not going to get the gains and this is all going to be a waste. So having said that, 2 to 3 times a week. Otherwise, once a week is sufficient. And depending on how the home exercise programs are going, I'll then taper them off. So then I'll then drop it down to every 2 weeks, and so on. Yeah.
Good. Right, we've got another question here. Do you treat pregnant women?
Yes, definitely. So that is in my scope as well. I probably didn't mention that at the beginning. Pre and postnatal, yes. Our degree does cover that, so I've definitely got training in that. I can also treat pregnancy patients that are high risk. So that's also my qualification, but you have to have a doctor's clearance. But yes, just because you're pregnant doesn't mean that you can't exercise. So there's a few modifications that you need to know about. Like certain things you can't do that are contraindicated, but yes, I can definitely train them.
Yeah, I mean, you're treating a patient at the moment who's had a couple of kids who's really struggling, and she's done brilliantly. She's
doing amazing. She literally came into me with awful pain, couldn't move, and just by doing pelvic control, because a lot of it's got to do with the pelvis, she's managed to tighten up, and she's pain-free now. She can walk, she can actually pick up her kids without pain. The benefits have been amazing, unbelievable. Yeah.
Because one's often like, if I'm pregnant, I can't go in and see someone because I'm, and a lot of people are nervous and scared. But the best thing you can do is come and chat to someone, because we often say, look, if we're not the right people for you, we'll direct you in the right, to the right people. But I've seen you treat a lot of pregnant ladies or ladies post pregnancy that have done extremely well.
Definitely, and what's quite common with pregnant women, if any of you are out there have had it, quite often you get a separation in the stomach, and by doing exercises, you can dramatically reduce that separation, and that's what I did for this other patient.
That's great. Okay, we've got another question in here. I often roll or twist my ankle. What can I do to help prevent this from happening?
Okay, so that boils down to simple ankle weakness. Okay, so that would have to be ankle rehab. But if I can give you a tip, balancing. Balancing is the best thing to start getting ankle strong. Okay, but if you're doing it incorrectly, it could pose a little bit of an issue.
So do you balance in a shoe or without a shoe?
I prefer outside of the shoe.
So you balance barefoot?
Barefoot.
With your knee bent or your knee straight?
Knee, the leg you're standing on.
Yes.
Yeah, slightly unlocked, so not completely straight, just slightly unlocked, because otherwise you're just going to fall into the knee joint and you're going to compensate. So balancing, ensuring that your foot is firmly on the ground, so that you're not rolling out or in, and it's nice and stable. And just by simply balancing, we'll start to get the foot stronger. And then there's so many more exercises that you can do, resistant exercises with TheraBands, which I could happily just give to a patient.
What about shoes playing a role in that?
Yeah, I mean, it all depends on the person once again. If you can get a shoe that could stabilize your ankle joint, yes, but the problem is that you're then relying on a shoe to stabilize it. So as soon as your shoe is off and you're walking down the stairs, you'll just have the same problem. So it's always better to not rely on something external, rather use your muscles that you've got to strengthen.
Yeah, I would also say in that, you know, when I say your shoe, if someone was wearing like a ballet pump and they kept on rolling the ankle, try and wear a more stabilized, stabilized
supportive
shoe. Because then what will happen is it'll give you the ability to help the ankle so that you can start your exercises, recover, and then take it from there.
Definitely.
Right. And I see you running Bootcamp. What is that?
Yes. Okay. So Bootcamp is it's a bit of high intensity training. So I've just started the class, and the aim of my Bootcamp is that it's small and contained, and by that means I can really focus on each individual.
So how many people are coming?
Max 3 people.
So 3 people with you in the gym.
In the gym.
Doing specific rehab to get you fitter, stronger, more stable.
And just happier.
And what do the sessions cost?
So for the month of October, we have a discount for £20 per class.
Yeah.
But in general, £30 per class.
Okay. Great. Well, that's all we've got time for today. Sorry we had a technical difficulty. It's been great chatting to you guys. Please do send through your questions and we'll try and answer them. You're welcome to WhatsApp us or send it via Instagram. It's been a pleasure, Nicci and I, and do come visit us at 72 King William Street.
Thank you.